September 23rd, 2025. As a reminder to those in the audience, this is a public meeting and being recorded. Please mute your devices. And then first, we'll start with the Pledge of Allegiance led by Commissioner Boyce.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Before we get started, I'd like to take a moment to recognize a couple of important observances happening this month that touch all of our lives in meaningful ways. First, September is Suicide Prevention Awareness Month, a time to raise awareness, promote hope, and remind everyone that seeking help is a sign of strength. Suicide affects millions of people each year, yet far too many struggle in silence. This month, we are called to recognize the warning signs, encourage open conversations about mental health, and connect people to proven resources. One of those critical resources is the 988 Suicide and Crisis Lifeline, which provides free, confidential support 24 hours a day, 7 days a week to anyone in emotional distress or to anyone worried about a friend or a loved one. Together, by standing in strength, dignity, and hope, we can make a difference and help save lives. And I've shared my story several times as a suicide attempt survivor. I share that story to break stigma and to bring awareness that when you have access to resources, or that it's okay to not be okay, but it's okay to reach out when you need help. And when you have access to resources, you can absolutely get the help that you need and live a full, healthy, and full life. I would also say that when it comes to resources, Franklin County has the Credible Minds platform, but we also have our new crisis center that is open for anyone, so you will not be turned away. So please utilize that resource. We have Mental Health Mondays that you, Commissioner Boyce, I know, lead. Franklin County takes mental health very seriously, and we want everyone in our community to be able to thrive and not just survive. And so I don't know if my colleagues have anything to say about Suicide Awareness Month, but
Madam President, ma'am?
Absolutely.
Thank you so much. First, let me just begin by once again recognizing your courage and leadership for bringing the conversation of mental health to the forefront. I honestly, I kind of ran with the ball, but you are the inspiration around it, and your courage that you've shown in sharing your story publicly. I think it's hard if you're not in elected office, it's hard to help you understand that vulnerability and to be that far in vulnerability out there. I think in many ways you don't know it, but you're probably saving lives, and I want to recognize that. The second thing I want to say is that every mental health professional that I've talked to since we started our empowerment conference around mental health has said that mental health crises are on the rise. And that is, and I see Erica Clark-Jones here too, but that is an indicator that we've got some real work to do to ensure that our residents have the resources they need, that when they face the crisis, that we're a part of the solution, part of the resources. And that's, to Ms. Clark-Jones's effort, that's what the Crisis Center is all about. It's about being able to facilitate those crises scenarios to provide resources and services where they're needed instead of just locking folks up. And then the other layer of that is this unfortunate statistics around suicide. And so we're seeing numbers on the rise with veterans, with young people, with in different demographic and racial indications, all trending upward, that give us something to be alarmed about, but more importantly, to direct resources. So I say all that to say, while we're taking a moment to recognize Suicide Prevention Awareness Month, let us all think about our own mental health and prevent a moment of crisis by seeking help and resources that might be available to you now when it may not be at the crisis stage. So again, thank you for your advocacy. We've got a lot, advocacy, thank you. We've got a lot coming up around the Empowerment Conference and that we're going to do this year, and some other things we're thinking about. And hopefully, again, that your inspiration can help save some lives.
Thank you. Thank you for your leadership and continuing to move the conversation around mental health and empowerment. September is also Hunger Action Month, a time when communities across the country come together to raise awareness, provide nutritious food, and supporting neighbors facing hunger. Whether it's through volunteering, donating, or spreading the word, every action matters. Together, we truly can make a difference in our community. And with that in mind, it is my pleasure to introduce Mid-Ohio Food Collective's President and CEO, Matt Habash, who is joined today by Haley Carino-Lee, Government Relations and Advocacy Manager, to share more about the incredible work being done to support our neighbors and strengthen our community.
Good morning, President Crawley and Commissioners Boyce and O'Grady, Deputy Minister Bivens, good to see you again, and Administrator Wilson. Thank you all for the opportunity and for the continued, this is the month that we always try to remind people how severe the hunger challenge is in America through a Hunger Action Month. It used to be called Hunger Awareness Month, and we quickly realized that wasn't strong and bold enough, and we really needed to move people to action. And as President Crawley said, this is really about moving people to get involved, to volunteer. We had over 100,000 hours of volunteer time just within our own food bank over the last year, which was needed because we had 1.8 million visits to people coming to get help from our amazing partners. And that's a 58% increase over the peak of COVID, and I didn't think that was possible. So we're struggling at a time when federal resources are diminishing and some state resources are diminishing. But one of the partners we've had throughout all of this has been the Franklin County Commissioners. You guys and your team have done everything to support us, and I really do appreciate, most recently with the major freezer acquisition that we were able to do and rebuild our whole freezer system, but you've continually given us resources. We do not have a stronger partner, and I just want to say thank you to all of you as we continue to challenge the community. If we're going to solve this, it's going to be solved locally, and we're going to have to figure out how to do this locally, and that's the challenge that we have. So anything we can do from our end to continue to support the work that you're all doing, we'll continue to do that as well. Thank you for the opportunity.
Sure.
Thank you, Madam President, and thank you, Mr. Habash. It was such a pleasure to spend some time with you recently at the Food Collective. But you said something that I wanted to underline for the public that's staggering: 1.8 million visits. Well, Franklin County is less than 1.4 million residents, and so if you take perhaps Cleveland and another city, a large city in Ohio, put them together, then you've got the amount of people who needed that food resource, and that's just unacceptable. What you shared with me when we were touring the collective was that the numbers that are trending upward, and moreover, you indicated that the type of family you see coming in today for food support and help are often people who are working families, people who are they go to work day to day, getting a paycheck, but they need just a little more to help get them through the month or the week, and that says a lot about how far we have to go to ensure that everyone has the resources that you're doing, that you're deploying. Finally, let me just say too, I had a couple years ago we invested in quote unquote a freezer for when people say, well, you spent $1 million of this freezer, we're talking about a region that the Food Collective serves. How many counties?
20 counties, 613 partners right now.
And Franklin County is at the center of that, and being the large entity we are, but that freezer has created the opportunity to prepare the next stage of food service availability for Central Ohio, and it was just amazing. It was also very cold to walk in there, but it was amazing to just see the operations that you're deploying and the volunteers that were dedicated to. I got to talk to some of them, and you would have thought they worked there, because they're so dedicated to this cause. And so maybe there's more that we can do as a community to donate food from our own pantries, or maybe there's more that we can do to volunteer, whatever it is. Maybe this awareness opportunity gives us that chance to recruit folks in to do those things.
Thank you. I think that's very true, and it's this is an amazing. There's some myths out there, and one of them is that people are not working. That's probably the biggest myth. Most of the people we help that can work are working. Most of the people on SNAP are working. So we have these myths going on about putting people to work. They're already working, oftentimes 2 and 3 jobs, but they don't make enough money to pay the bills, and hence they come get food as they pay their other bills. So, it really is important. And most people come 5 times or less a year. And I think that's the other misnomer. People get free food, they come all the time. That is not true. 30% of the people come once a year, 70 come 5 times or less. They're only coming when they have to. But fortunately, working poor people right now have a lot of financial challenges, and we tell them, please pay their bills, their other bills, because it's harder to find a house, and it is harder to keep a car, and it's harder to pay the utility bills and keep them on. So come take care of those things, and we'll help with food. And this community has been responsive to that for decades. So thank you.
Madam President.
Absolutely.
I just want to say thanks for the work that not only you do, but your staff does around our food board, our food policy, our food plan that we've put together here in Franklin County, and the involvement of the Food Collective with the work that the food board and the food action plan that the county and the city have been doing over the years has been critical. So we appreciate you guys being a part of that.
Thank you. If you haven't seen our farms, please come take a look at them, because they're amazing, and we really use them as a teaching tool to teach everybody else in the community how to continue that we can grow our own food in a lot of ways. So thank you. Thanks for all the support.
And thank you for all that you do for the community.
Thank you.
Happy to be a partner. All right. Before we start our agenda, yesterday marked National Centenarians Day. I knew I was going to mess that up. Observed each year on September 22nd as a time to honor those who have reached the incredible milestone of 100 years. It's a celebration not only of their longevity, but also of the remarkable contributions they have made to their families, communities, and our shared history. Here in Franklin County, we are proud to recognize and celebrate 7 extraordinary residents who will be joining the ranks of centenarians in 2025. Lucy Owens, Elva Lumet, Harold Hall, Alice Klein, Pleasant Cooper, Mary Yerian, and Mary Lyons. These remarkable individuals are a living testament to resilience, perseverance, and strength, offering valuable lessons from a lifetime of experience and embody the progress and longevity of our society. I pray one day I make it to 100 years. So congratulations to them.
I don't want to make it to 100 years.
Oh, you don't? I do. I want to make it to 104, actually. So don't ask me why, but that's what I want. Okay.
May I have a personal point of privilege?
Yeah, absolutely.
Thank you, Madam President, for a personal point of privilege. I'd like to take a second to just recognize a special guest that I have with me today, and she shadowed me for part of the day. So excited to have State Representative Meredith Lawson-Rowe here with us. If you could just stand up and say hello, wave to the crowd here. She asked one day about what does the county do, what services that we offer and how we operate. And I said, well, why don't you come over and spend the day with us? And she's taken us upon that. And I think that really helps you be a better state representative, because we work very closely with the legislature, and the things that we do, essentially, counties are an extension of state government. We carry out many of the duties that come from the state of Ohio, and we're governed by state of Ohio law. And so I'm so glad that you're taking the time to come spend the day with us. Welcome.
Yeah. It's always good to see you. We were together yesterday. I was a guest lecturer at the Ohio State University Marsha Pitzer Center for Women and Youth, and then you came to Conversations with Crowley as well, and so you're shadowing Commissioner Boyce, and so just inspired by you and the work that you do, but always wanting to learn more, always asking the right questions, and so yeah, I'm sure you'll have a fun day today. All right, we have a county administration update. I will pass it over to county administration.
Thank you, President Crawley. Kenneth Wilson, County Administrator. This past Thursday at briefing, Deputy County Administrator Joy Bivens provided an overview of the landscape that we will be facing as a county as a result of recent federal legislation that was approved, and you all asked that we provide that briefing again here in general session, so that the public will be informed as to the impact that's coming up in a very short time in fiscal year 2026. So we want to provide this overview in a brief fashion. So I will now turn it over to Deputy County Administrator Joy Bivens to give a overview of H.R. 1 and its impact on SNAP, Medicaid, and other public assistance programs.
Michael,
Okay.
it's not on the screens.
I can go ahead and just get, okay.
Thank you.
So, good morning, and thank you, County Administrator, thank you, Commissioners. If I could just really quick, before I begin, because I know I didn't get a chance to send them a note. I see Josh is here. Josh, this is your last, I think, general session with us before he starts his military assignment, so.
Where's Josh? I don't see him.
He's in the back. He's in the back. Yeah, he's leaving us. Yeah, so I think he's going to be leaving us for almost a year, so you will be missed, and thank you so much for your service. Yeah. Commissioners, as you know, I represented you in Franklin County on the National Association of Counties Health and Human Services Education Steering Committee. I was asked to go to Congress to present to a congressional group on the Ag Committee to talk about SNAP. And I'm so glad we started today talking about SNAP from the Mid-Ohio Food Collective. And we need to, as a community and as a country, dispel some myths. So as I go through this, I'm going to talk about two things on a high level, one being SNAP, the other being Medicaid. As you all know, that the HR bill, also known as the Big Beautiful Bill, passed by Congress earlier this summer, included a series of new requirements under SNAP and Medicaid and public assistance across the country. For those of you who do not know, SNAP is the largest federal nutrition program, providing approximately 42 million low-income individuals with monthly grocery benefits. I know, Michael, I'll know where I'm at, and I'll direct you. Just take a look at the screens. I'm sorry. 42 million low individuals with monthly grocery benefits, as well as employment and training. So in order to receive SNAP, you must be working or going to school. I really want to make sure that we dispel the myth. I'm seeing some things on social media with some keyboard warriors stating some things that are untrue. Many folks that are working, that are receiving SNAP, are in that lower earning income, as well as in Franklin County, over 50% of the folks that receive SNAP are seniors and children. So currently, right now in Franklin County, we have about 183,000 folks that receive SNAP. So how does the bill work? As you all know, that Ohio was one of 10 states that receives dollars from the federal government to administer SNAP. So dollars come from the feds down to the state, down to the county, in order for us to administer SNAP, and that goes to our Job and Family Services. Again, Ohio is one of the states that administers SNAPs at the county level. Not all states do it that way, but again, we are one of 10. So in this bill, there are several requirements that they're asking, that are mandating to change. Adults age 18 to 64 and adults with dependents age 14 will now need to complete work requirements. So 14 and over, you will have a work requirement in order to receive SNAP. It was 18 to 54 previously. We have new limits for calculating utilities. There was a utility allowance that we could take into account when administering your SNAP benefits from your gross income to ensure ensure residents receive the highest number of benefits. That has now changed. We are now only allotting that in the case of if you have a disabled resident, family member, or senior in your household. And there are restrictions for non-citizens other than green card holders will no longer qualify for SNAP food assistance. You can change. Again, major changes to SNAP. I talked about previously in the HR bill, our dollars come from the feds down to the state, down to the county in order to administer. So in order to administer SNAP, there is a cost share that the states and the counties take on. So the feds currently take on about 50%. They are now reducing that to 25%. So 75% of that cost share will now be shared by the state. What does that mean for Franklin County? The states will be required to pay a higher percentage of cost. So it is estimated in Franklin County, in order to administer SNAP to the 183,000 folks that we know needed, Franklin County potentially could pay $7.5 million additionally in order to administer that benefit on top of what the commissioners allocate out of the budget, out of the general fund budget for that program to run. What does that mean? That means the commissioners are going to have to make some decisions on things they would essentially need to fund, which means less dollars could potentially go into the community. There's also the change with SNAP where we're going to start sharing, and this is not on here, Michael, I'm going to the error rate. There's an error rate as it relates to SNAP from residents not turning in the proper documentation, not maliciously, but just things get lost. Sometimes you turn in an old pay stub. For residents who are Ubering, their wages fluctuate. And so there are error rates that each county incurs. And so for the error rate, the state now will have to pay for the error rate. And error rates over a certain percentage, I believe it's 9%, will have to pay the feds back for that error rate. The error rate at one point was 9%. I think it's 6% now. We need to keep, or 7% now. We have to keep it at the below the 6%, so we do not have to pay that error rate. If we were to incur that error rate today, based on the 9% error rate, it would be $300 million that this state would have to pay. And Franklin County was sharing that. And so that's not happening, so everyone just, it's okay. We are working hard. The questions were, why do we have error rates? When you have 183,000 folks doing 183,200 billion things, it's easy to make an error from the resident and from the worker. It takes at least a year for a worker to be proficient in processing a case because we're processing from the perspective of understanding policy. We process a case from policy, not this fancy technology that automates for us. So then there's that. We can go to the next slide. And then the next change is to Medicaid. This will be the first time in history that, and many of you are familiar with Medicaid, it's a free, low-cost health care option for low-income residents. A lot of the residents that you see in Franklin County or across the country that leverage Medicaid, they're either working for companies that do not offer health insurance, they're disabled, or they have chronic illnesses that do not allow them to work. And so in this particular, this provision, this will be the first time in history that residents will be required to have work requirements in order to receive Medicaid. And so those folks could, and we have about 409,000 people currently right now in Franklin County that receive Medicaid. So including over 170,000 children. So in our expansion group, we're not only going to be processing Medicaid, but in this provision, the feds are now stating that the change would be administratively, in order to requalify for Medicaid, you have to recertify twice a year, whereas one time a year now. So you sign up, we get you signed up, then you sign up one time a year currently. With this new provision, we now have to touch your case twice a year. We have a lot of transient population, things change, which could cause a lot of errors. So there's a lot of eligibility restrictions. Most non-citizens other than green card holders will no longer qualify for Medicaid. Again, there will be work requirements for homeless children, children aging out of foster care, and veterans. There will be, again, more frequent renewals in order to receive Medicaid. And I want to make mention that with all of these administrative burdens that are going to incur in order to process these cases or to touch these cases, there are no additional administrative dollars to support this work. So the agency that administers both SNAP and Medicaid will now have to look to the commissioners for fiscal support so that we can continue to support our most vulnerable in this community. What does that mean for the community? That means that the commissioners, again, are going to have to look at budgets and figure out the most essential things that they feel that we should fund and the things, unfortunately, that they are unable to fund because there's not unlimited dollars. Next slide, please. So again, that is the most high level. In that hearing, there were conversations on how folks are utilizing their Medicaid card. There is a work group, I believe, that monitors how folks are using their SNAP card from the perspective of buying things that they feel that are not nutritious. And what I said to Congress is people purchase things that they have accessibility to and that they're affordable. We have food deserts currently even here in Franklin County. So a lot of residents utilize their SNAP card so it can stretch. Fruits and vegetables are expensive. Most healthier foods are expensive for residents. But there are a lot of different opinions and different provisions in this bill that we are still navigating. But I will tell you, this is the biggest cut in history that has come to both SNAP and Medicaid, and those cuts impact administrative function for us to be able to do the things we need to be able to do so residents have what they need. But with the commissioner's leadership and support, and with the HHS team, we are going to try to look at innovative ways so we can not only increase accessibility, but ensure that there is no resident that gets left behind during these times. A lot of these changes will take place in the year 26 up until the year 28. We are now going across the county, educating the county residents on what is ahead of, what they can do. I sat in on a stakeholder group with Congresswoman Shontel Brown yesterday, as well as our own HHS team, who will be out in the community educating folks on what is happening. We would ask that you please look into the website. We do have some information on there that you could take a look at as these provisions come forward. Thank you, commissioners.
I do have a question. Yep. Thank you, Madam President. Thank you, DCA Bivens. A couple of things. One, regarding the SNAP benefits, I think you said 180,000 people receive SNAP benefits. And for the public's context, that would be larger than the city of Dayton, larger than the city of Canton, larger than the city of Youngstown, Springfield, et cetera, et cetera. You know the cities. So it's a lot of people right here in Franklin County. And then you said something else. We have 409,000 Medicaid residents. That would be, if our Medicaid residents were a city, it'd be the second largest city in Ohio. So given the conversation that we had earlier about food and some of the decisions that we're going to have to make as a commission with regarding the rate that we have to put in, is there any scenario where our residents are in jeopardy of reduced benefits? So in other words, do we just simply have to meet that new threshold? Is that a requirement? Or could it get to the point where if we didn't have those resources, then the state would reduce the amount of people who receive benefits or the benefit that they receive?
The benefit is based on your family size and income. So that's the qualifying indicator on how much you receive. These rates that we have to pay based on errors are just maybe there was an overpayment and those types of things. I don't foresee, based on what the qualifying indicator it would decrease. However, it could be more administrative costs on you, the commissioners, in order to administer, so that these folks can receive those dollars. Because the feds could say you're paying more because of your error rate, so in order to administer, you're going to pay more, and it has to come from somewhere.
And so whatever we have to pay, Madam President, whatever we have to pay is basically set based on that formula. And so so that's tough on our part because that number could go in
Yes.
any direction. But more importantly, residents shouldn't be concerned right now about losing
No.
or getting reduced benefits.
Not at all.
Okay.
Residents should be concerned about, that we did talk about fraud at the congressional hearing. And just like a credit card, there is an EBT card that SNAP residents receive. However, it does not have the same sophistication that a person with a credit card or a debit card had, meaning it does not have a chip. So there was a lot of SNAP skimming that took place, and that can happen at a grocery store. There is no sophistication in order to monitor when someone's SNAP benefits are stolen. So when they're stolen, they're gone. They have to wait until the next month in order to receive those benefits.
Thank you.
Thank you for that update. I would just always encourage our residents to reach out to their representatives, to their members, and advocate for continued support and funding.
I do want to make mention for our homeless population that is changing. So that's what you're going to see. There must be work requirements in order to receive your benefit, and that's going to change starting in 26, I believe, Bart, am I 26 or 27?
For the SNAP residents.
Yeah.
It starts as early as November.
Yeah, and so veterans, the homeless population, you must be working 80 hours per month. And so what that means on us, commissioners, is, as you see, we're going to start infusing the one-door model into high-traffic areas so that we can help more people. But what it's going to cause for us to do is making sure that we're implementing an intensive case management model so that the homeless population can have what they need.
Thank you.
Thank you.
All right, to the regular agenda. First up, we have Court of Common Pleas.
Resolution number 68225, resolution authorizing the purchase of the For the Record Gold Software annual subscription to provide coverage of the audiovisual equipment installation by New Era Technology in the amount of $246,388.52.
Good morning, Commissioners. Kimberly Canada, Director of Finance for the Common Pleas Court, and with me is Susan Bedsole, Deputy Court Administrator. She's in the gallery. This resolution authorizes the contract modification for the purchase of the For the Gold software annual subscription, which was inadvertently omitted from the investment summary of the original contract with New Era Technology. This SaaS subscription will ensure coverage for the AV equipment across 30 courtrooms at the Common Pleas Court General Division. The total amount of the modification is $246,388.52. Pending any questions.
Thank you, Commissioners. We do have one speaker slip on Resolution 68225. So at this time, I'd like to welcome DJ Burns to the podium. As you're coming forward, just a quick reminder of the rules for public comment. Speakers will be limited to 3 minutes for their remarks. Speakers may only speak on the resolution item at hand, 68225, and all comments will be directed to the Board of Commissioners. Permission to speak may be denied or terminated if remarks are disrespectful or antagonistic. As soon as you begin, we'll go ahead and start the timer, and I will let you know when your 3 minutes are over.
Good morning. I just came in to praise you guys for this investment. FTR Gold, as you know, has been the flagship property for the Record since 1988. Looking forward to the never-ending quest in the modernization of justice that this update will provide. And it also allows courts to stream content, which will come in handy for our many constituents who can't get enough of true crime TV in Franklin County. But I just have one question. I promise it'll make sense. Bear with me. Has anyone in this room been to Japan recently? I see you nodding your head, Commissioner O'Grady. You were. I got a tip. President Crawley, O'Grady, and Administrator Wilson were in Japan recently. I was just wondering why I'm finding that out in my inbox and not like. It seems to me, well, you know, you guys are so good with press releases, why that wasn't advertised to our beautiful constituents, and if that was a taxpayer-funded trip to the great nation of Japan.
No idea, but it was a great trip. Foreign direct investment's important in Franklin County.
Do you know who? So you don't know who paid for it?
I'm sure that.
Like it just you magically
sure
got
that
an
it was
itinerary? Generally, if somebody presented me I'm not trying to be crass.
It's not the first time I've been to
Oh, I'm aware. Yeah, I'm aware. I'm just reading all these papers about
Oh.
the budget. You know, we're tightening the belt here, and now I just find, you know, a paid junket to Japan, and nobody seems to know who paid for it. I just was curious. But this goes standard. I appreciate it. I just want to know. There will be forthcoming records requests, so thank you for your time.
Thank you.
If there are no further comments or questions, move for adoption of 682-25. Is there a
Got a
second?
Second,
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
yes.
Commissioner Crawley?
Yes.
Thank you. Resolution 68225 has been adopted. Resolution 68325, resolution authorizing the acceptance of the pre-award conditions for the FY 2024 Burns State Crisis Intervention Program Subgrant Award and granting authority to County Administrator to sign all pre-award documents related to the grant program.
Thank you. With me is Shannon Bradshaw, the RISE Program Coordinator in the gallery. This resolution accepts the pre-award conditions from the State Crisis Intervention Program and authorizes the county administrator to sign the documents in anticipation of receiving the grant award of $145,000. All associated documents from the pre-award have been reviewed and approved to form by the Franklin County Prosecutor's Office. This grant will be utilized by the court's mental health specialty docket, RISE, pending any questions.
If there are no comments or questions, move for adoption of 683-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 683-25 has been adopted.
Thank you.
Thank you. Next up, Clerk of Courts.
Resolution 684-25, resolution authorizing a supplemental appropriation to support expenditures related to the court case management system project.
Good morning. Jennifer Goodman, Court Administrator for the Common Pleas Court General Division, and with me this morning in the gallery is Bill Seeloff. He's the Director of Legal Operations for the Clerk of Courts. Bill and I also serve as co-chairs to the Executive Steering Committee, for the Case Management System project. This resolution requests supplemental appropriation in the amount of $292,136 for this project fund. The request is necessary based on the timing of invoices that we've received in 2025. It is not a result of any contract expansion or additional costs. This resolution has been reviewed and approved by the OMB office as well. Pending any questions, we request your approval.
If there are no comments or questions, move for adoption of 684-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 684-25 has been adopted.
Thank you.
Thank you.
Next up, Coroner.
Resolution 685-25, resolution authorizing the acceptance of a Coverdell Forensic Science Improvement Grant, Franklin County Coroner Forensic Science Improvement, to purchase laboratory supplies, offset increased opioid-related testing costs, upgrade analytical software, reduce the forensic toxicology backlog, and expand the testing scope in the amount of $47,704.90.
Good morning, Commissioners and County Administration. Dan Baker, Chief Toxicologist for the Coroner, Nathaniel Overmeyer. This resolution approves a grant award for the Coverdell Forensic Science Improvement Grant in the amount of $47,704.90. This resolution also authorizes the County Administrator to execute the grant agreement. Pending any questions, I respectfully request your approval of this resolution.
If there are no comments or questions, move for adoption of 685-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 685-25 has been adopted.
Next up, Drainage Engineer.
Resolution number 686-25, resolution authorizing a transfer of funds for the Stormwater Management Program.
Good morning, Commissioners. Nick Soulis on behalf of Adam Fowler, the Franklin County Drainage Engineer, and the Franklin County Engineer. Commissioners, this resolution authorizes the transfer of approximately $1.3 million from the general fund to the Stormwater Management Fund. These funds will be used to cover operating and capital improvement expenses for the Drainage Engineer for the second half of 2025. Pending any questions, I ask for your approval.
If there are no comments or questions, move for adoption of 686-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 686-25 has been adopted. Resolution number 687-25, resolution awarding contract and approving contract bond to Strasser Paving Co., Inc. for the Roar Road widening, Bigsby Road to Shook Road project in the amount of $3,548,334.79.
Commissioners, this particular project, the Roar Road widening, is seeking to improve the road by providing left turn lanes at Bixby Road and Creekside Parkway, and includes the addition of a two-way left turn lane. This project was competitively bid with a bid opening on August 26, 2025, and Strasser Paving Company was determined to be the lowest and best bidder. Pending any questions, we ask for your approval.
If there are no comments or questions, move for adoption of 687-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 685-25 has been adopted. Resolution 68825, report second of the Franklin County Engineer establishing sums of compensation for a portion of the owners of property abutting the Zuber Road, Plum Road drainage improvements, Pleasant Township and Jackson Township, Franklin County, Ohio, in the amount of $11,228.
Commissioners, this resolution seeks compensation for 3 property owners abutting the Zuber Road Plum Run Drainage Improvement Project. Located in southwest Franklin County in Pleasant and Jackson Townships, the project seeks to improve drainage in the area. We did successfully negotiate with the property owners, and compensation is based on appraised fair market value. Pending any questions, we ask for your approval.
If there are no comments or questions, move for adoption of 688-25.
Second.
Moved and seconded voting, Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 68825 has been adopted. Resolution 68925, resolution authorizing disposition of personal property, including motor vehicles and equipment, which are no longer needed for public use, are obsolete, or are unfit for the purpose for which it was acquired, and authorizing the Franklin County Engineer to dispose of said items by transferring title by internet auction.
Commissioners, this final resolution, as the title indicates, seeks to declare certain equipment obsolete and authorizes the sale or proper disposal of the identified equipment. Our office will observe the requirements of the Ohio Revised Code and this board's resolution 276-24 that was adopted on April 2nd in 2024 as we process this equipment. Pending any questions, we ask for your approval.
If there are no comments or questions, move for adoption of 689-25.
Second.
Moved and seconded voting, Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 68925 has been adopted.
Thank you, Commissioners. Have a great day.
Thank you.
You too.
Alcohol, Drug, and Mental Health Board.
Resolution number 68125, resolution authorizing a distribution from the One Ohio Opioid Settlement Fund for support of the Franklin County Crisis Center.
Good morning, Commissioners. Zach Telerik with the Office of Management and Budget. This resolution would authorize a distribution of $2.5 million from the local opioid settlement dollars received directly by the county through the One Ohio Memorandum of Understanding. These funds are being allocated to Adam H. to support service delivery at the newly opened Franklin County Crisis Center. With us today is Erica Clark-Jones, CEO of Adam H., and Anthony Perry, CFO, to talk about the Crisis Center and how these dollars will support Adam H.'s system of care.
Thank you for the introduction, and thank you, Director Telerik. I want to extend my gratitude not only to you, but of the county staff that have been working to support this resolution, to President Crawley, Commissioner Boyce, Commissioner O'Grady, and Administrator Wilson. Thank you for the opportunity to address you this morning. To Commissioner Crawley and President Crawley specifically, thank you for your courage. It is Suicide Prevention Awareness Month. We take that very seriously at the Adam H. Board, and your leadership and your courage is noteworthy. I just wanted to support your statement with a few statistics. Every year in Franklin County, we lose over 150 residents to suicide. In 2024 alone, it was 184 individuals. And we see the trend rising, particularly among males, teens, and our older adults, individuals over 70 years of age. 25% of the alcohol, drug, and mental health budget goes to prevention activities among those populations and others here in our community. So I just wanted to thank you for keeping the drumbeat loud and alive so that everyone can see they're worth living, and we need their contributions to our community. So thank you.
Thank you.
So on behalf of our board members, I want to express my deepest gratitude for the additional resources being provided for the Franklin County Crisis Care Center through this allocation of the county's One Ohio settlement funds. I have a few statistics that I'll share with you that I think you will be encouraged by. With the opening of the Crisis Center on September 2nd, just 3 weeks ago today, we have entered a new era in how we triage and better support individuals experiencing mental health and addiction crises. We're now able to ensure that care is not only more accessible, but delivered in the most appropriate way for an individual's needs. This 24-hour-a-day, 7-day-a-week facility is a powerful complement to our entire system of care, and its impact is already being felt. In its first 15 days of operation, the center welcomed nearly 200 individuals. Of these, 52% were brought by first responders, including police and EMS. That's 94 individuals who did not end up in an emergency room or at jail. An additional 9% arrived via our mobile crisis teams. Adam H supports 5 mobile crisis teams that operate around the clock, and some support our law enforcement personnel. So 16 people arrived via our mobile crisis teams. And another 30%, or 54 individuals, arrived on their own, already aware of this new resource in our community. That's a really strong start to the first 15 days of operations, and our provider recovery innovation said it's one of the strongest starts they've had across the nation. So I commend you all for your support of this resource early on, and we clearly see it's meeting a need in our community. This investment will have a great impact on not just our community, but the individuals and their families, and it demonstrates your commitment to our ongoing service. Per this resolution, these funds for the Crisis Center operations allow Adam H to free up levy dollars originally allocated to the Crisis Center to respond to other emergency needs within our network of providers. As a result, and as detailed in the resolution, Adam H will be establishing a new initiative to assist providers experiencing financial distress related to electronic health record system issues. Through this initiative, Adam H can provide timely funding to providers to help resolve issues related to billing systems that have impacted their ability to collect payment for services, leading to cash flow and other financial challenges. As DCA Bivens mentioned earlier, these are uniquely challenging times for several agencies, but particularly our provider agencies, especially when the demand is high. In administering these funds, Adam H will require, through an application process and a criteria for demonstration of need, but we will require any provider agency not only to demonstrate their needs, but be able to give Adam H access to their books to verify distress as a result of EHR system transitions. Additional reporting requirements will allow us to monitor compliance and establish sufficient controls, or at least confirm sufficient controls in using these public dollars. With the continued support of Franklin County, we are making a real difference in people's lives, and we will continue to keep the systems that sustain our residents available. Thank you for your consideration of this important and timely resolution.
Thank you.
Madam President, may I make a comment? Thank you. I wanted to just take a second to acknowledge the mobile crisis team. I had the opportunity to see them in action recently over on East Long Street, and the training to which these folks have, and I know DCA Bivens was helpful, and so you, Ms. Clark Jones, the training that these individuals have to be an intervention in between law enforcement and lockup to assist them in evaluating not just their crisis scenario, but the triage that you identified, and then to have an alternate place to take them, because I think I've seen it before the crisis center, and I've seen it after the crisis center. And before the crisis center, the options were fairly severe in the intake part. I won't name names, but in terms of those places they went, other than the jail, but they were not they were not always an appropriate experience to get folks where they needed. In particular, I'm thinking of the young lady that we dealt with recently that was in a crisis and called you guys. So along Long Street are a number of new businesses, and I have the pleasure of getting to know a lot of them on a regular basis. And so some of it is new to them. They've got their business and they've got the area. Still, there are folks who are still in crisis at times, and so we've been able to sort of get all those businesses to, one, take in our resource book, so there are options that they can call. But two, we have direct line to the mobile crisis unit that you've given us that, and we've had to deploy it a couple of times, and it's just been, I mean, these folks are just outstanding. just outstanding. And I remember my first experience with hospice. I'm a family member, and I remember thinking to myself, man, those people are amazing. Like, wow, like, I've never seen anything like it. People are just so great with somebody in that phase. And I would liken the mobile unit to those folks. That's a little bit of a dark comparison, but I meant the skill, the attention, and the love that they put, and the care that they handle folks with is just outstanding. I watched these folks in action, and I was in awe, and they were in my place, and so it was handling the person, and I mean, just a very good thing to watch about our community, and to know that this is somewhat new. The mobile crisis unit was there, but now to have this alternate location, and if you've been there, you see it's a place that is made right. You know, it's made right, and it's made for the right thing. And so I just wanted to acknowledge those folks out there. And I don't recall the names. I was trying to recall the names of the ladies that came out, but they were just A-pluses all around.
Thank you.
Yeah.
It's really important, and I'll be happy to share your feedback with them. Thank you.
I do have a question about the adult mobile crisis unit. I guess what is being done to reach like our immigrant and refugee population, who that population remains kind of unfamiliar with mobile services, and then also just has a distrust for the system. So can you speak to what engagement you're doing?
That's a great question, President Crawley. So first and foremost, I want to highlight the continuum. 988 is now available in our community, and any member of our community can call that number. They do significant triage on the phone, actually really working through, my understanding is over 85% of the calls are handled, and they can assess and essentially de-escalate a situation via the phone, and that's available 24 hours a day, 7 days a week. But when a mobile team needs to be dispatched, we don't ask about status to deploy a team. We have 9 teams total in our community. Adam H. supports 5 of those teams. Some work with the VA, others work with Columbus Public Health and Columbus Police Department as well. And so they arrive on scene and treat the challenge, because that is the emergency at the time. Just as an EMS worker would come out and triage and treat the individual on site, that is how our mobile crisis response teams work at this time. So anyone is able to call.
As it relates to the crisis center and its opening, what have you, just in the past 3 weeks, what are you seeing? Are you seeing trends already, or? Yeah.
Thank you, President Crowley. It's a great question. We spent some time with the RI personnel last week just to start going over statistics. The first thing we've seen is that law enforcement and first responders are trusting the facility. The fact that we had such a significant number of individuals brought by EMS and first responders, 52% of people came there, they trust the process. We are doing what we said we would do. We spent a lot of time building relationships and making sure people understood this new resource and how to use it before it was opened. And so we recognize in our community right now, 80% of the calls for support for an individual in a crisis that they define, either a mental health or a substance use disorder, they call 911. That's the trend we'd like to reverse over the next 3 years. We'd like to have 80% of the calls going to 988. But right now, 80% of folks that call in, they call in 911. And so first responders respond to that call, and they now have this option to bring people to the center. So we knew that having that trust built with EMS, fire, and police was critical to make sure the system was being utilized. So in those first 3 weeks, we are earning that trust. We are continuing to make good. I love the fact that we've had so many people walk in and felt like it was a place for them. That was by design. As Commissioner Boyce mentioned, the way the facility is designed with a welcoming lobby that doesn't turn anyone away, that we can address needs. We have a 24-hour observation or 23-hour observation unit. We connect individuals to community-based agencies so that they don't have to ask if their crisis does not demand an escalated response. We can make those connections on site. We have also seen community-based agencies have come in the space that we've designated for them, which is a first, by the way, across the country. They have come in, set up shop excuse me, with their technology and made the connections while individuals are on unit. That is new behavior for us, and we think that's healthy behavior and positive. So we're going in the right direction. We absolutely are just awaiting data every day, and we'll be able to start making sense of some of the trends. But right now, what we can say is the trust is continuing to build, but we started with a good grain of trust as well.
That's good to know. Thank you.
Thank you.
Madam President. It's really good to see you here this morning. I haven't had a chance to see you in a while. I know we spoke a couple of weeks ago when I was in Japan. It is, which is difficult because, there's a 13-hour time difference.
That's right.
And so, but it was important that we talked while I was there. But anyway, I'm glad that you are here this morning, and it is, the work that you guys are doing at the Crisis Center is important. And your reputation precedes you, even though you've only been open for less than a month. Because, while we talk to our colleagues around the state and around the country, we hear, we're getting questions about, even before you were open,
Wow.
about the center and what you were building and now what is open. People have been excited about it and are excited for it and want to come and see it. And want to, and so we will be reaching out to you at some point to hopefully get folks tours to be able to come and check it out. So if we can, I don't know if we can still arrange for that or not.
I was going to say.
It might be tough, right?
It is difficult now.
Which is fine. If we can't get tours, then we'll have to have you guys then have some explanations and meet with some folks because the center is definitely creating a buzz, and so people have definitely been asking about it. So, we will, but that's always a good thing, and just like we've had lots of, for different reasons, as we talked on the day that I took my tour, we've had a lot of people, as DCA Bivens knows, or DCA Long knows, lots of people wanting tours and taking a look at the correction center. We've had lots of people that have had a very keen interest in the Crisis Center. So thank you for all the work that you're doing.
Thank you, Commissioner Grady. I will tell you, we have a 3-minute video produced with our team and RI that we are sending out to constituents and stakeholders. Just yesterday, we were before a group of pastors who wanted to know more about the center and who they can call. Much like Commissioner Boyce, what you mentioned, they want that relationship. And we did provide them with a 3-minute video that takes you on a virtual tour. But we think we'll get even more creative as we continue to get inquiry. The Association of International Architects has come out because they think it's a model for how to build a crisis facility with dignity that supports mental health and addiction crisis. And the 2028 National Council on Mental Wellbeing has selected Columbus and Franklin County to be the host of the national conference, in part because they really agree with our approach to crisis care here. So we will be celebrating alongside you as we welcome professionals from across North America.
Great.
Commissioners, Joy Bivens, Deputy County Administrator of Health and Human Services. Thank you so much, Ms. Clark-Jones. I just wanted to make mention, November 4th through the 6th,
Yes.
We are hosting 35 health and human service leaders from around the country. They asked me who and what I would like to highlight. You can blame my colleague. I volunteered you. So we're going to be here in the government complex for a couple of days. I did explain to them they could not see possibly an in-tour, but we could possibly set up some time for you to spend some time with them. Second thing, really quick, Chief Pride and I were at NACO at a mental health roundtable, and this is all they talked about. They want to know more. They want to know more. Last thing, if there's any of an opportunity for our Wonder model to come in
Yes.
to assist residents, because what we're finding is, particularly for some folks who are making some very impulsive decisions just because of fiscal issues, we can assist, and they're making some very unfortunate, choices, and we can come in and assist and mitigate some of those things.
Deputy County Administrator Bivens, President Crawley, and Commissioners, absolutely. We can. I thought about one of our centers, particularly the Crisis Center, as a one-door facility, so I'd love to talk more about coordination there. And November 4th through 6th, happy to participate after the polls call us on November 4th, because your Adam H. Organization and the Crisis Center is on the ballot this fall. And so we are asking for the residents of Franklin County to support us and continue this work. Thank you.
Okay. If there are no further comments or questions, move for adoption of 681-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes,
Resolution 68125 has been adopted.
thank you. Have a great day. Next, we have Franklin County Data Center.
Resolution number 69125, resolution authorizing a contract with Mapsys, Inc. for professional services related to the upgrade and migration of Franklin County Public Defender's structured query language database server into the data center's environment in the amount of $15,000.
Good morning, Commissioners and County Administration. Renee Rupel, Financial Services Manager for the Data Center. The Data Center manages over 1,200 databases that serve various functions, from allowing the public to access court case information online to providing us with resolution information for general sessions. These databases operate in an environment that requires upgrades every 2 to 5 years to improve performance, reliability, and most importantly, security. The Public Defender's SQL database is undergoing this upgrade, and they have a third-party application matrix that sits on that database. This contract is to engage that vendor to assist with the upgrade and transition to the new server, and ensuring that the application continues to function properly after the upgrade. Pending any questions, I respectfully request your approval of this resolution.
If there are no comments or questions, move for adoption of 691-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes,
Resolution 69125 has been adopted.
Thank you.
thank you. Next up, Public Defender.
Resolution number 69025, resolution authorizing a one-year contract between the City of Columbus, the Franklin County Board of Commissioners, and the Franklin County Public Defender Commission in the amount of $1,132,367.
Good morning, Commissioners. Christy Clarizio, representing the Franklin County Public Defender's Office. This resolution is for the 2025 contract between the City of Columbus, Franklin County Board of Commissioners, and Franklin County Public Defender Commission to provide legal services to indigent persons in Franklin County Municipal Court. The total estimated cost of services in this program for this year is $8,436,479. It is estimated that 58% of the cases in the Muni Court will be state charged misdemeanors, and this estimate is based on last year's actuals. The cost to the county is estimated to be $4,893,158 before the state reimbursement. State reimbursement is estimated to be 75%. After the state reimbursement, the county obligation is estimated to be $1,222,289. 42% of the cases in Muni Court will be city charged, a cost to the city in the amount of $3,543,321. It is estimated that after the 75% state reimbursement and the 2024 reconciliation in the amount of $246,536, the city obligation and the amount of this contract today is $1,132,367. Pending any questions, I ask for your approval of this resolution for this year.
If there are no comments or questions, move for adoption of 690-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes,
Resolution 69025 has been adopted.
Thank you.
thank you. Office on Aging.
Resolution number 69225, resolution authorizing a grant agreement with Aging Solutions that will provide services and programming in order to promote and support access to social determinants of health for seniors in Franklin County in the amount of $11,930.
Good morning, Commissioners, County Administration, Madam Prosecutor Shonda Wingo, Director for the Franklin County Office on Aging. Many seniors across Franklin County face growing challenges related to financial stability, particularly those from fixed incomes or in historically underserved communities. Addressing economic stability is one of the core domains of the social determinants of health and is essential to ensuring long-term well-being and independence for older adults. FCOA solicited grant proposals from various Franklin County nonprofit organizations and entered into 45 grant agreements on April 15, 2025, under the approval of Resolution Number 278-25 for the provision to fund expanded or innovative programming and services that will enhance the seniors' quality of life. FCA received one additional grant proposal from Aging Solutions to help fund Safe and Healthy Home program. This program provides the financial literacy education and benefit enrollment assistance, emergency financial relief, and personalized financial coaching for older adults. This grant program will focus on the social and community context and healthcare access and quality, as well as economic stability. The Franklin County Office on Aging wishes the authorization of the grant agreement with Aging Solutions to provide these services not to exceed $11,930,000 for the time period of August 1st of 2025 through December 31st of 2025. This investment aligns with goal number 12 of the Franklin County Rise Together Blueprint. And pending any questions, we will respectfully request the approval of this resolution.
If there are no comments or questions, move for adoption of 692-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 692-25 has been adopted. Resolution number 693-25, resolution authorizing a contract modification and extension number 3 with Duraline Medical Products, Inc. for incontinence supplies for the Franklin County Office on Aging in the amount of $2,100,000.
The Franklin County Office on Aging administers the Franklin County Senior Options Program, which is a consumer-focused system of care funded by the Senior Service Levy. FCOA entered into an original contracting agreement with Duraline Medical Products, Inc. on August 30 of 2022 under the approval of Resolution Number 0608-22 from RFP Number 2022-11-18 for the provision of providing incontinence supplies. The term of the original contract did include, it was for 1 year with 4 options to renew. FCOA and Duraline Medical Products mutually agreed to extend the original contract for another 1-year term and increase the rates by 1.5% under Resolution Number 0731-23 through August 31st of 2024. FCOA and Duraline Medical Products mutually agreed to extend the original contract for another year through August 31st of 2025. The Franklin County Office on Aging wishes the authorization of this contract and modification extension with, it's the third extension, for the total dollar amount not to exceed $2,100,000, and the term will be from August 1st, 2025 through September 30th of 2026. This includes allowable rate increase, again, of the 1.5%, and the vendor incorporates 6 additional items or products for pricing on the sheet. This resolution supports goal number 9 of the Franklin County Rise Together Blueprint, and pending any questions, we respectfully request approval of this resolution.
If there are no comments or questions, move for adoption of 693-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yeah.
Commissioner Crawley?
Yes.
Resolution 693-25 has been adopted. Resolution number 694-25, resolution authorizing a contract with Crosby's Drugs Incorporated to provide nutritional supplements for seniors in Franklin County in the amount of $750,000.
In 2025, Franklin County opened a request for proposal for nutritional supplemental services in accordance with Section 307.86 of the Ohio Revised Code under RFP number 2024-11-42 to provide nutritional supplemental services to Franklin County residents and was competitively bid through the purchasing department. The contract requires the supply and delivery of nutritional supplements to Franklin County senior citizens receiving services through the Franklin County Office on Aging and Senior Options Program. The Franklin County Office on Aging wishes the authorization of this contract with Crosby Drugs in the total amount not to exceed $750,000. The term will be for 1 year, beginning September 29th, 2025 through September 30th of 2026. There are 4 one-year extension periods, and the vendor may request a market adjustment in pricing. This resolution supports goal number 10 of the Franklin County Rise Together Blueprint. Pending any questions, we respectfully request approval of this resolution.
If there are no comments or questions, move for adoption of 694-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crowley?
Yes.
Resolution 694-25 has been adopted.
Thank you.
Next up, economic development and planning.
Resolution number 695-25, review of a petition to annex 26.904 acres more or less from Jackson Township to the City of Grove City, case number ANX-26-25.
Good morning, Commissioners, County Administration. Emmanuel Torres, Assistant Director of Economic Development and Planning. This first resolution considers an expedited Type 2 annexation petition from Jackson Township to the City of Grove City. The area to be annexed, as described in the petition, includes one parcel located at 4910 Hoover Road. The City of Grove City has passed an ordinance indicating that services will be provided once the annexation is approved. The petition does meet all statutory requirements outlined in Section 709.021 and 709.023 of the Ohio Revised Code. Pending any questions, I respectfully request your approval.
If there are no comments or questions, move for adoption of 695-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crowley?
Yes.
Resolution 695-25 has been adopted. Resolution number 696-25, review of a petition to annex .3 acres more or less from Franklin Township to the City of Columbus, case number ANX-27-25.
Commissioners, this resolution also considering an expedited Type 2 annexation petition. The area to be annexed, as described in the petition, includes two parcels located at 2562 Briggs Road. The City of Columbus has passed an ordinance indicating that services will be provided once the annexation is approved. The petition meets all statutory requirements outlined in Section 709.021 and 709.023 of the Ohio Revised Code. Pending any questions, I respectfully request your approval.
So questions, move for adoption of 696-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crowley?
Yes.
Resolution 696-25 has been adopted. Resolution number 697-25, review of a petition to annex 111.2 acres more or less from Madison Township to the City of Canal, Winchester, case number ANX-28-25.
Commissioners, our last resolution, also an expedited Type 2 annexation petition. The area to be annexed, as described in the petition, includes one parcel located at 5593 Hayes Road. The City of Canal, Winchester has passed an ordinance indicating that services will be provided once the annexation is approved. The petition meets all statutory requirements outlined in Section 709.021 and 709.023 of the Ohio Revised Code. Pending any questions, I respectfully request your approval of this resolution.
No comments or questions, move for adoption of 697-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crowley?
Yes.
Resolution 697-25 has been adopted.
Thank you. Have a great day.
Thank you. You too. Next up, Job and Family Services.
Resolution number 698-25, resolution approving a contract amendment with Access to Interpreters LLC for interpretation and translation services in the amount of $5,592,389.
Good morning, Commissioners and County Administration. Carmen Barnes, Assistant Director, Job and Family Services. Our agency is committed to providing meaningful access to program information, benefits, and services for our limited English proficient or LEP residents, as required by law. Our Access to Interpreters provider provides these services for our residents. In any given month, Access to Interpreters provides approximately 700 hours of on-site interpretation services for the most common languages that we hear. They also offer approximately 35,000 minutes per language each month for over-the-phone interpretations. And we continue to see an increase in the needs for these services. This resolution is actually an amendment to an agreement that was signed in 2022. It's the third amendment, and it will provide an additional $450,000 in TANF funding to allow us to continue to provide these services through the current fiscal year. And that is what we are requesting today. So pending any questions, I ask for your approval of this resolution.
If there are no comments or questions, move for adoption of 698-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 69825 has been adopted. Resolution 69925, resolution approving a subaward agreement with the St. Vincent Family Center to support transportation services for Medicaid-eligible youth participating in day treatment programs in the amount of $600,000.
St. Vincent Family Center is a recognized leader in pediatric behavioral health care. Their St. Vincent Prep Academy day treatment program serves children who have behavioral or serious emotional challenges. On average, enrolled children receive mental health counseling services for 6 to 9 months before they're ready to be returned to school full-time. The families with children enrolled at the center have incomes that are typically at or below the poverty level and lack reliable transportation to support their child's daily attendance at the center programming. So under this award, St. Vincent's will provide and administer non-emergency transportation services for approximately 305 Medicaid-eligible children enrolled in the day treatment program. Pending any questions, I ask for your approval of this resolution.
Commissioner, so Carmen, just really quick. So for the children that receive medical transportation, and I'm just thinking just because there's a lot of things we have to do with Medicaid right now, Medicaid does not pay. This is not a billable service to Medicaid for them to receive transportation under their HMO, I'm assuming.
Billable to the family? or
Billable to the HMO. This is not a Medicaid billable service.
I would need to follow up on that. I'm not sure
We need to
about
make
that
sure, because the thing is,
specifically.
if we can save some of those dollars and possibly bill Medicaid, we can preserve some of the $600,000.
Okay.
Yeah.
That's something we can certainly follow up on.
Please, yeah.
If there are no comments or questions, move for adoption of 699-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 69925 has been adopted.
Thank you.
Thank you. Next up, Justice Policy and Programs.
Resolution number 725, resolution authorizing a sub-grant award agreement with the Columbus Coalition for the Homeless on behalf of the Central Ohio Restored Citizens Collaborative and Urban Minority Alcoholism Drug Abuse Outreach Program of Franklin County for the planning and implementation of the 2025 Restored Citizens Summit and the 2025 Tree of Life Stop the Violence event under the FY 2022 Justice Assistance Grant in the amount of $10,000.
Good morning, Commissioners. Melissa Pearson, Interim Director with the Franklin County Office of Justice Policy and Programs. This year, our office was able to award 2 mini grants in the amount of $5,000 each with the obligated FY 2022 Justice Assistance Grant funds to offset the costs of hosting two large resident community outreach events. The first award to the Columbus Coalition for the Homeless on behalf of the Central Ohio Restored Citizen Collaborative is to support their annual Central Ohio Restored Citizen Summit, which is designed to empower our restored residents through networking and conference sessions focused on mental health, employment, and financial literacy. It is anticipated 350 restored residents will be in attendance. The second award is to the Urban Minority Alcoholism Drug Abuse Outreach Program in support of their Tree of Life event, Tree of Life Stop the Violence event at the Driving Park Recreation Center. The organizers anticipated 300 attendees this year. However, this year hosted up to 800 attendees, with 748 of them signing a pledge against violence. Both subgrant awards support Goal 9 of the Rise Together Blueprint, and pending any questions, I respectfully ask for your approval.
If there are no comments or questions, move for adoption of 700-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 725 has been adopted.
Thank you.
Thanks. Next up, we have purchasing.
Resolution number 70125, resolution approving purchases for various Franklin County agencies in the amount of $4,123,295.46.
Good morning, Commissioners, County Administration, Megan Perry Ballinier, Director of Purchasing. This resolution requests your approval of 101 purchase orders. The County Auditor has pre-certified available funding, and pending any questions, I respectfully request your approval of this resolution.
If there are no comments or questions, move for adoption of 701-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 70125 has been adopted.
Thank you.
Thank you. Next, Board of Commissioners.
Resolution 70225, resolution accepting the amounts and rates as determined by the Budget Commission for collection in calendar year 2026 and authorizing the necessary tax levies and certifying them to the county auditor.
Good morning, Commissioners. Zach Telerik with the Office of Management and Budget. This is the annual authorization and certification that is required to be completed before the first day of October in each year pursuant to Section 5705.34 of the revised code. The certification does not include the levy for the Columbus Zoo that expires at the end of the year. If the Columbus Zoo levy is approved on the November 4th general election ballot, an amended certification will be submitted for your approval early next year. Pending any questions, would ask for your approval.
If there are no comments or questions, move for adoption of 702-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 70225 has been adopted. Resolution number 70325, resolution authorizing the county administrator to enter into a First Amendment with Justice Planners.
Good morning, Commissioners. Chris Long, Deputy County Administrator. In 2023, this board adopted an agreement with Justice Planners to provide forecast analysis in conjunction with the phased construction of the Adult Correction Center. There's value in continued current forecast analysis and needs assessment on the adult side for future bed needs, including forecast validation and updates. There's also a need for similar analysis for the Juvenile Intervention Center for both the needs assessment, stakeholder interviews, collection and analysis of data, growth and future needs, and analysis of space needs. Justice Planners has the expertise to do both, and with your assent, we would respectfully ask for approval of this resolution.
If there are no comments or questions, move for adoption of 703-25.
Second.
Moved and seconded voting. Commissioner Boyce?
Yes.
Commissioner O'Grady?
Yes.
Commissioner Crawley?
Yes.
Resolution 70325 has been adopted.
Thank you. Are there any journalizations?
Yes. Madam President, we have two. The first, case ANX-31-25, an expedited Type 2 annexation petition. ANX 3125 was filed with the Franklin County Economic Development and Planning Department on August 27, 2025. The petition is requesting to annex 1.9 acres from Mifflin Township to the city of Columbus. The petition will be considered by the Board of Commissioners on October 7, 2025. Site, 3505 Westerville Road, parcel ID number 190-000089. And the second, case ANX 3325, a municipal annexation petition. ANX 3325 was filed with the Franklin County Economic Development and Planning Department on September 8, 2025. The petition is requesting to annex 53.795 acres from Plain Township to the city of New Albany. The petition will be considered by the Board of Commissioners on October 7, 2025. The site, 7839 Bevelheimer Road, parcel ID number 220-001355.
Yes.
Can I now start ribbon cutting today?
Go ahead.
Okay. Good morning again. Just really quick, today we are doing a ribbon cutting. Our commissioners will be there. We're going to do it at the Heart of Ohio. This will be the first time, I believe, in history that we have infused all of our health and human service agencies, and we call it our one-door model, into a healthcare system. Normally what we do is we put a case manager in a hospital or at a site. Now we're testing a model at one of our federally qualified health clinics, Heart of Ohio, today at 1 o'clock. So when residents go in and get their prescriptions, their medical care, their pediatric services, they can check on their benefits, they can get aging services, they can check on their child support case, and all the things that they can get, they will be offered if they walk into any of our brick and mortar buildings. Again, that is, I believe, today at 1 o'clock, Sam. I'm shaking. Yep, today at 1 o'clock, 5000 East Main Street. We are really excited because we believe that this is going to be a model that we can test around the country.
Thank you. With no other business to come before the board, we are adjourned. Happy Tuesday.